ನಮ್ಮ ಇವತ್ತಿನ ಸ್ಪೆಷಲ್ ಸೆಷನ್ ಆಸ್ ದಿ ಎಕ್ಸ್ಪರ್ಟ್ ಸೆಷನ್. ಆಸ್ ಆಲ್ರೆಡಿ ಮೆನ್ಷನ್ಡ್, ಇವತ್ತು ನಮ್ಮ ಜೊತೆ ಒಬ್ಬರು ಸ್ಪೆಷಲ್ ಗೆಸ್ಟ್ ಇರ್ತಾರೆ. ಸೊ ಆಲ್ರೆಡಿ ನಾವು ಪ್ರಾಸ್ಟೇಟ್ ಹೆಲ್ತ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಿದ್ವಿ. ಲಾಸ್ಟ್ ಕೆಲವು ಸೆಷನ್ಸಲ್ಲಿ ಫೀಮೇಲ್ ರಿಲೇಟೆಡ್ ಗೈನಕಾಲಜಿಕಲ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಬಗ್ಗೆ ಎಲ್ಲ ಮಾತಾಡಿದ್ವಿ. ಸೊ ಇವತ್ತು ವಿ ಆರ್ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಪ್ರಾಸ್ಟೇಟ್ ಹೆಲ್ತ್. ಸೊ ನಾಟ್ ಜಸ್ಟ್ ಅಂದರೆ ಏಜ್ ಆಗ್ತಾ ಎಲ್ಲರಿಗೂ ಪ್ರಾಸ್ಟೇಟ್ ಸಂಬಂಧ ಪ್ರಾಬ್ಲಮ್ಸ್ ಬರುತ್ತೆ, ಎಸ್ಪೆಷಲಿ ಅಂದರೆ ಮೇಲ್ಸಿಗೆ. ಸೊ ಅದರಲ್ಲಿ ಕೆಲವು ಅಂದರೆ ಪ್ರಾಸ್ಟೇಟ್ ತೊಂದರೆಗಳು ಏನಕ್ಕೆ ಬರುತ್ತೆ, ಅದನ್ನು ಯಾವ ರೀತಿ ನಾವು ತಡಿಬೋದು, ಸಿಮ್ಟಮ್ಸ್ ಏನಿರುತ್ತೆ, ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ಯಾವ ರೀತಿ ಇರುತ್ತೆ ಅನ್ನೋದನ್ನು ಇವತ್ತಿನ ಸೆಷನಲ್ಲಿ ನಾವು ನೋಡೋಣ. ನಮ್ಮ ಜೊತೆ ಈಗ ಒಬ್ಬರು ಸ್ಪೆಷಲ್ ಗೆಸ್ಟ್ ಇದ್ದಾರೆ, ಡಾಕ್ಟರ್ ತರುಣ್ ದಿಲೀಪ್ ಜವಳಿ ಅಂತ. ಅವರು ಈಸ್ ಅ ಫೇಮಸ್ ಯೂರಾಲಜಿಸ್ಟ್ working at MS Ramaiah Medical College and Hospital. And before we start the session, on the small introduction about Dr. Javali, on the name, sir, let me add pin. Yes, welcome to the session, sir. So just a small introduction before you can, after that, ನೀವು ನಿಮ್ಮ ಟಾಕನ್ನು ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೋದು. ಸೊ ಬೇಸಿಕಲಿ ನಮ್ಮ ದಿಸ್ ಇಸ್ ಲಿವ್ ಟು 100 ಕಮ್ಯುನಿಟಿ. ಐ ಡೋಂಟ್ ನೋ ನಿಮಗೆ ಇದ್ರ ಬಗ್ಗೆ ಎಷ್ಟು ಗೊತ್ತಿದೆ ಅಂತ. ಸೊ ಬೇಸಿಕಲಿ ವಿ ಹ್ಯಾವ್ ದಿಸ್ ಕಮ್ಯುನಿಟಿ ವೇರ್ ವಿ ಕೋಚ್ ಪೀಪಲ್ ಆನ್ ಹೌ ಟು ಯೂಸ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಸ್ ಅ ಮೀನ್ಸ್ ಟು ಸ್ಟೇ ಹೆಲ್ದಿ, ಡಿಸೀಸ್ ಫ್ರೀ ಆ್ಯಂಡ್ ಸೈಂಟಿಫಿಕ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿಫಿಕೇಷನ್ನ ಕೋಚ್ ಮಾಡ್ತೀವಿ. ಸೊ ವಿ ಹ್ಯಾವ್ ಡಿಫ್ರೆಂಟ್ ಲೆವೆಲ್ಸ್ ಆಫ್ ಪ್ರೋಗ್ರಾಮ್ ಆ್ಯಂಡ್ ಪೀಪಲ್ ಮೇನ್ಲಿ ದಿಸ್ ಇಸ್ ಫಾರ್ ಕರ್ನಾಟಕ ಆಡಿಯನ್ಸ್. ಪ್ರೋಗ್ರಾಮ್ಸ್ ಎಲ್ಲ ಕನ್ನಡದಲ್ಲಿ ನಡೆಯುತ್ತೆ. ಆ್ಯಂಡ್ ಎವ್ರಿ ಮಂತ್ ವಿ ಗೆಟ್ ಅ ಗೆಸ್ಟ್ ಸ್ಪೀಕರ್, ಯಾವುದೋ ಒಂದು ಹೆಲ್ತ್ ರಿಲೇಟೆಡ್ ಟಾಪಿಕ್ ಮೇಲೆ ಗೆಸ್ಟ್ ಸ್ಪೀಕರ್ಸ್ ಬರ್ತಾರೆ. ಸೊ ಡಾಕ್ಟರ್ ತರುಣ್ ಜವಳಿ ಅವರು MBBS ಮತ್ತು MS ರೆಪ್ಯೂಟೆಡ್ ಜಿಪ್ಮರ್ ಪಾಂಡಿಚೇರಿಲಿ ಮಾಡಿದ್ದಾರೆ. ಆ್ಯಂಡ್ ಐ ಥಿಂಕ್ ಅವ್ರದ್ದು ಪ್ರೊಫೈಲ್ ನೋಡಿದ್ರೆ ಇಟ್ಸ್ ವೆರಿ ಅಕಾಡೆಮಿಕಲಿ ಸ್ಟ್ರಾಂಗ್ ಪ್ರೊಫೈಲ್. ಯಾರಾದರೂ ಮೆಡಿಕಲ್ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್ ಇದ್ದವ್ರು ಗೊತ್ತಿರುತ್ತೆ. ಸೊ ಆಫ್ಟರ್ ದ್ಯಾಟ್ ಅವ್ರದ್ದು MCH ಯೂರಾಲಜಿ ಮಾಡಿದ್ದವರು ಆಲ್ ಇಂಡಿಯಾ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಮೆಡಿಕಲ್ ಸೈನ್ಸಸ್ ನ್ಯೂ ಡೆಲ್ಲಿಯಲ್ಲಿ. ಅದಾದಮೇಲೆ ಅವರು ಪೋಸ್ಟ್ ಡಾಕ್ಟರಲ್ ಫೆಲೋಶಿಪ್ ಇನ್ ರೀನಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ರೆಪ್ಯೂಟೆಡ್ ಸಂಜಯ್ ಗಾಂಧಿ PGI ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಇನ್ ಲಕ್ನೋ ಅಲ್ಲಿ ಮಾಡಿದ್ದಾರೆ. ಅದಾದಮೇಲೆ ಶಿ ಈಸ್ ಬೀನ್ ವರ್ಕಿಂಗ್ ಇನ್ Ramaiah ಹಾಸ್ಪಿಟಲ್ಸ್. ರಾಮಯ್ಯದಲ್ಲಿ ಇಸ್ ಪ್ರೊಫೆಸರ್ ಆ್ಯಂಡ್ ಯೂರಾಲಜಿಸ್ಟ್, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಯೂರಾಲಜಿ, ಆಂಡ್ರಾಲಜಿ ಆ್ಯಂಡ್ ರೀನಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆ್ಯಂಡ್ ರೊಬೋಟಿಕ್ ಸರ್ಜರಿ, ಅದರಲ್ಲಿ ಪ್ರೊಫೆಸರ್ ಆಗಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ದಾರೆ. ಸೊ ಆ್ಯಂಡ್ ಲಾಟ್ ಆಫ್ academic background ಇದೆ. ಇಟ್ಸ್ ಪಬ್ಲಿಷ್ಡ್ ಮೋರ್ ದೆನ್ 50 articles in reputed journals and books ಅಲ್ಲೆಲ್ಲ ಚಾಪ್ಟರ್ಸ್ ಬರೆದಿದ್ದಾರೆ. ಐ ಥಿಂಕ್ ವಿ ಶುಡ್ ಬಿ ಪ್ರಿವಿಲೇಜ್ ಟು ಹ್ಯಾವ್ ಹಿಮ್ ವಿತ್ ಅಸ್. ಥ್ಯಾಂಕ್ ಯು ಸರ್, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಜಾಯ್ನಿಂಗ್. ಆ್ಯಂಡ್ ಐ ಜಸ್ಟ್
thank you for inviting me. It's a pleasure to be part of your program. You're doing a wonderful job, and getting people to know about all the various health issues. It's a phenomenal job that you're doing, and it's a privilege for me to be on your Zoom meeting today.
So, yes, sir. I think you can start your presentation and talk. Yes.
Yeah, I'll just share my presentation. Just give me a minute.
Yeah.
Can you see the slide?
Yes, sir. It's visible. Yeah.
The full slide is visible?
I think you need to slide show mode. Yeah. Yeah. Yes. No, yeah. Now it's fine. Yeah.
Yeah. So, if I speak in English, is it okay, or in between little Kannada?
So I think ಎರಡು ಮಿಕ್ಸ್ ಮಾಡಿದ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ.
Because certain terms will be.
Yeah, that's okay. Terms people will understand. So although everybody will understand English, but ಮಧ್ಯದಲ್ಲಿ ಸ್ವಲ್ಪ ಕನ್ನಡ ಮಿಕ್ಸ್ ಮಾಡಿದ್ರೆ it will be useful for them. Yes.
So good evening to all the viewers.
Just a minute, sir. Just a second. Just a minute. I think ನಂದಿದಾಗೋಯ್ತು. ಎಸ್ ಸರ್, ಈಗ ನಿಮ್ಮ ಪ್ರೆಸೆಂಟೇಷನ್ ಒಂದೇ ನಿಮಿಷ. ಲೆಟ್ ಮಿ ಗೋ ಟು ದ ಪ್ರೆಸೆಂಟೇಷನ್.
You can see.
ಒಂದೇ ನಿಮಿಷ. ಐ ಥಿಂಕ್ ಇಲ್ಲ, ನಿಮ್ಮ ಸ್ಕ್ರೀನ್ ಬರ್ತಾ ಇದೆ. ಒಂದೇ ನಿಮಿಷ. ಒಂದು ನಿಮಿಷ, I think. One second, sir. I'll just.
Sure. No problem.
Yeah, I'll
You're
remove.
getting my screen?
Yeah, the screen is visible. Nandu ಇದು ಬರ್ತಾ ಇದೆ. I just want to remove my so that two ಇದು ಆಗಬಾರ್ದು ಅಂತ ನಿಮ್ಮನ್ನು ಮಾತ್ರ ಪಿನ್ ಮಾಡ್ತೀನಿ. ಒಂದೇ ನಿಮಿಷ. Yes, sir. I think it's good. You can go ahead. Yeah.
Yeah. Good evening to all the viewers. ಇವತ್ತು ನಾನು ಪ್ರಾಸ್ಟೇಟ್ ಹೆಲ್ತ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತೀನಿ. So this will be of more concern to the, of course, prostate as an organ is there only in the males. Very ganasirgirutte. And so this will be of interest predominantly to the gentlemen, but also, of course, women who have husbands, brothers, and fathers. For them also, it will be of useful. So, idu prostate andre eno. So, idu ondu gland. It's a size of a walnut shape. And idu, it is below the bladder. Bladder kelade irutte. Amale, adu urine pipe antivala, urethra, which leads from the bladder to the outside. It goes to the prostate gland. Iga prostate the main function ಏನಂದ್ರೆ during the reproductive age group, although it produces the seminal fluid which carries the sperm. So the main use of the prostate is in the reproductive age group for the transport of the sperms by the seminal fluid. So after that, there is not much role of the prostate gland. Okay. And so the normal prostate size is around 20 grams. And as the age increases, the prostate size increases. So, iga prostate gland nalli, what are all the various different diseases which can occur in the prostate gland? One most common is the enlarged prostate because of the age. It is called the benign prostatic hyperplasia. Benign andre non-cancerous. It is also called as benign enlargement of the prostate, which occurs because of the aging, because of certain hormonal changes, and that is inevitable. For some, it may cause problems. For some, it may not. Something similar to cataract. The other condition is prostatitis anta heltivi. Prostatitis andre infection of the prostate gland. It could be acute infection or chronic infection. The third is the prostate cancer. Prostate nalli cancer pura develop agbodu. So these are all the three main conditions which can affect the prostate gland. Now, as I told you, we'll first discuss the benign enlargement of the prostate. We are discussing two most frequent conditions. Iga one benign enlargement, the prostate cancer. So iga benign enlargement of prostate, although it, as I told you, depends on the age. As the age increases, the size of the gland increases and the problems similarly appear. If you see at the age group of 31 to 40 years, only 8% of men will have an enlarged prostate. That is more than, say, 25-30 grams of the prostate size. In the age group of 51 to 60, more than 50% will have enlarged prostate. And in the 8th decade, 9th decade, almost all will have some prostate problems or the other. So, what happens? Prostate, as I told you, can see in this diagram. This is the urinary bladder. The marker kansta. Can you see?
Yeah. Yeah.
This is the urinary bladder where the urine is stored. And through this pipe, it comes out. It's called the urethra, which comes out. And the prostate gland is below the bladder, and the urethra passes through the prostate gland. So this on the left-hand side is the normal size of the prostate. On the right-hand side, because of the enlarged prostate, it causes compression of the urethra. So urine will not pass freely. And this causes some degree of obstruction, and urine remains in the bladder. So the symptoms which are caused by the enlarged prostate, they are called by the acronym LUTS. LUTS andre lower urinary tract symptoms. Lower urinary tract andre prostate, bladder, urethra. Upper urinary tract andre kidney matte ureter. So this can cause, because of the enlargement, it can compress the urethra and leading to of urine in the bladder, and this can cause various problems. And this can be divided as obstructive or voiding symptoms and healthy. Andre obstructive symptoms means like poor flow. The speed of the urine becomes less. They're not able to empty the bladder completely. Always adu sensation irutte. Innu ಸ್ವಲ್ಪ ಇದೆ ಉಳ್ಕೊಂಡಿದೆ ಅಂತ symptoms ಬರುತ್ತೆ. ಆಮೇಲೆ speed ಇರಲ್ಲ. So these are called the obstructive symptoms ಅಂತ. ಇದು ಬಿಟ್ಟು next irritative symptoms ಏನಾಗುತ್ತೆ, because of the bladder is trying to pump urine against some form of a blockage. So bladder undergoes changes and becomes thick-walled. So that will cause irritative symptoms, frequent urination, ಆಮೇಲೆ ಅರ್ಜೆನ್ಸಿ, ಯೂರಿನ್ ಬಂದಾಗ ತಕ್ಷಣ ಹೋಗ್ಬೇಕಾಗುತ್ತೆ, ಹೋಗ್ಲಿ ಅಂದ್ರೆ ಸ್ವಲ್ಪ ಲೀಕ್ ಆಗ್ಬೋದು. ಆಮೇಲೆ ನೈಟ್ ಅಲ್ಲಿ ಪದೇ ಪದೇ ಎದ್ದು ಉಚ್ಚೆ ಮಾಡುತ್ತದೆ, ಅದಕ್ಕೆ ನಾಕ್ಚೂರಿಯಾ ಅಂತೀವಿ. So these are called the irritative symptoms, and sometimes it can also cause some infection. So infection ಆದಾಗ burning pain, urinary infection, blood in the urine. So these are all the symptoms of the enlarged prostate. Okay. If anybody has some questions, you can stop me in between also. There's no problem. Now, yes, coming to the complications of the benign prostate hyperplasia or benign enlargement. So, sometimes patients can present with retention, sudden blockage of urine. Patient is having severe pain, not able to pass urine. So ಅದಕ್ಕೆ acute retention ಅಂತ ಹೇಳ್ತೀವಿ. ಹಂಗಾದ್ರೆ patient has to come to the emergency. ಆಮೇಲೆ urinary catheter ಅಂತ ಹಾಕ್ತೀವಿ to relieve the blockage. So ಅದಕ್ಕೆ acute retention. ಇನ್ನೊಂದು, as I told you before, recurrent infections. ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, because ಇದು prostate is blocking the free flow of urine, enlarged prostate is preventing the free flow, urine remains in the bladder, and that can trigger infections. Especially more common in diabetics with uncontrolled diabetes, high sugars, and immunocompromised patients. So, ಇಂಥವ್ರಿಗೆಲ್ಲ ಇದು recurrent infections ಆಗೋ ಚಾನ್ಸ್ ಇರುತ್ತೆ. Because the urine is remaining in the bladder, it is not getting emptied completely, it can lead to bladder stones. And over long-term blockage ಆಗ್ಬಿಟ್ಟು, back pressure change ಆಗ್ಬಿಟ್ಟು, kidney ನಲ್ಲಿ ಊತ ಬಂದ್ಬಿಡುತ್ತೆ. That can lead to renal insufficiency or kidney failure. This is the last step. Next is the decompensated bladder. ಅಂದ್ರೆ ಏನಾಗುತ್ತೆ, because the bladder is trying to pump out urine, over time it becomes fatigue, just like ಈಗ heart failure ಆದಾಗ ಆ ತರ. This is called bladder failure. Bladder becomes very weak, and even in these patients, even if we relieve the obstruction by doing the prostate surgery, because it is there for many years, bladder has undergone irreversible change ಆಗ್ಬಿಟ್ಟು, we're not able to, bladder is not able to pump out the urine even after relieving the obstruction. ಇದಕ್ಕೆ decompensated bladder ಅಂತೀವಿ. And other complications like hematuria, ಅಂದ್ರೆ blood in the urine ನಲ್ಲಿ ರಕ್ತ ಇದು bleeding ಆಗೋ ಚಾನ್ಸ್ ಇರುತ್ತೆ. So these are all the complications of BPH. So ಈ ತರ ಲಕ್ಷಣಗಳು ಇದ್ರೆ ಪೇಷಂಟ್ಸ್ ಬಂದಾಗ ನಾವು ಹೇಗೆ ಇವ್ರನ್ನ ಇವ್ಯಾಲ್ಯೂಯೇಟ್ ಮಾಡ್ತೀವಿ? ಒಂದು ಹಿಸ್ಟ್ರಿ ಮತ್ತೆ ಎಕ್ಸಾಮಿನೇಷನ್. Most common is the prostate examination, which is generally done by putting a finger in the motion passing area, rectum. ಯಾಕಂದ್ರೆ as you know, I'll just show you. Okay, we'll come to that. The prostate is just in front of the rectum and can be easily accessed by putting a finger in the rectal area. With that we can see ಎಷ್ಟು ಮಟ್ಟಿಗೆ enlargement ಆಗಿದೆ, prostate the texture ಹೇಗಿದೆ. If it is hard and nodular ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂತಾದಿದ್ರೆ there may chances of prostate cancer. So this is the prostate examination or digital rectal examination. We also do some other testing like the uroflowmetry anta. This is an electronic commode where the patient has to pass urine and we get a graph. So it tells the speed of urination. It gives a lot of clues regarding what is the degree of blockage, ಎಷ್ಟು ಮಟ್ಟಿಗೆ block ಆಗಿದೆ, ಹೇಗಿದೆ flow. So these are all some of the tests. Then next is the ultrasound. You can see on the right hand side there's a picture. Urinary bladder, ultrasound of the bladder. This is the prostate. This is the prostate. It is indenting and healthy. It is going into the bladder. This is the median lobe of the prostate. So this is the prostate enlargement seen on the ultrasound. And we also evaluate the symptoms. One important thing to notice, to keep in mind is symptoms can be severe or mild regardless of the prostate size. Some men with 20, 30 grams, 40 grams prostate, they can have a lot of urinary problems. Some men with 100 grams prostate or symptoms irlikilla. So it is not just dependent on the prostate size. It depends on the bladder dynamics, any infection. So a lot of factors come into the play. How much of the prostate is protruding into the bladder and other comorbid conditions of the patient. So all these come into play in deciding the severity of the symptoms. One important investigation which we do in men, because as I told you, idu prostate nalli prostate cancer kuda barbodu. So starting stage prostate cancer nalli ಏನು symptoms ಇರಲಿಕ್ಕಿಲ್ಲ. Then how to distinguish from the benign enlargement of prostate? We do one test called the PSA, and the PSA stands for prostate specific antigen. This is the blood test. So the normal value should be less than 4. If it is more than 4, then we have to suspect that there is something wrong, that we could be dealing with prostate cancer. But sometimes PSA increases even when the infections adagu in PSA increase agutte. So we have to be careful. We can't always assume high PSA means prostate cancer, but it is one of the we have to keep that into account. Now coming to the treatment options. What are all the treatment options for the prostate enlargement? Now, not all patients require treatment. If symptoms ಏನilla, urine speed ಚೆನ್ನಾಗಿದೆ, patient is not getting disturbed by the urinary issues or very mild symptoms, and PSA is normal, no signs of infection, we can just wait and watch. There's no need for any medical treatment or surgical treatment. ಇದಕ್ಕೆ watchful waiting or lifestyle modification ಅಂತ ಹೇಳ್ತೀವಿ. Andre we ask them to restrict the water intake, not too much, just to, you need not take more than 2 liters per day. Especially ಯಾರಿಗೆ nocturia ಅಂದ್ರೆ ಯಾರು ಪದೇ ಪದೇ ನೈಟ್ ಎದ್ದೇಳ್ತಾ ಇದ್ದಾರೆ. So we ask them to cut down fluids in the evening, cut down bladder irritants. Bladder irritants andre which irritate the bladder to cause increased frequency, like tea, coffee, alcohol, spicy food. All this we ask them to decrease, and control the sugar symptom, the diabetes. Because if sugars are high, patient will have increased water intake and increased urine production. They have to control the sugars, and high sugars can lead to urinary infections. So this is watchful waiting, medical treatment, lifestyle modification. The next is the medical treatment, which is the alpha blockers and therapy. This is for patients who have more moderate symptoms. We initially start with medical treatment. Example is tamsulosin or silodosin and the healthy. These medicines are taken especially in the night because side effects can be there, especially giddiness. So night ಊಟ ಮಾಡಿ just ಮಲ್ಕೋಕ್ಕಿಂತ ಮುಂಚೆ ಒಂದು ಟ್ಯಾಬ್ಲೆಟ್ ತಗೊಂಡು ಮಲ್ಕೋಬೇಕು. So this can help in a majority of the patients. ಯಾರಿಗೆ ಮೆಡಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಂದ ಏನು ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗ್ತಾ ಇಲ್ಲ, ಸಿಂಪ್ಟಮ್ಸ್ ಹಂಗೆ ಇದೆ, ಆರ್ ಮೆಡಿಸಿನ್ಸ್ ಇಂದ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಆಗ್ತಾ ಇದೆ. ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಅಂದ್ರೆ ಗಿಡಿನೆಸ್ ಆರ್ ಟಯರ್ಡ್ನೆಸ್. So then we give them the option of undergoing a permanent solution in the form of surgery. So surgery nallo there are different options. One is the gold standard tried and tested method, adike transurethral resection of the prostate antivi. So all the prostate surgeries are done through the urinary passage area. There is no cutting or stitching involved, and idu ಒಳಗಡೆ ಹೋಗ್ಬಿಟ್ಟು ಅದು ಪ್ರಾಸ್ಟೇಟ್ ಏನ್ ಬೆಳೆದಿರುತ್ತೆ ಒಳಗಡೆ ಬ್ಲಾಕ್ ಮಾಡ್ತಾ ಇದ್ರೆ ಆ ಪಾರ್ಟ್ ನ ಅಷ್ಟೇ ತೆಗೆದು ಅದನ್ನ ಟೆಸ್ಟಿಂಗ್ ಕಳಿಸ್ತೀವಿ. ಸೊ ದಿಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಟ್ರಾನ್ಸ್ಯುರೆಥ್ರಲ್ ರಿಸೆಕ್ಷನ್. ಈಗ ನ್ಯೂವರ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಆರ್ ಅವೈಲಬಲ್. ಲೇಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ. ಆಮೇಲೆ ಈಗ ಮೋರ್ ಮಿನಿಮಲಿ ಇನ್ವೇಸಿವ್ ಆಪ್ಷನ್ಸ್ ವಿಚ್ ಕ್ಯಾನ್ ಬಿ ಡನ್ ಆನ್ ದಿ OPD ಬೇಸಿಸ್ ಇಟ್ ಸೆಲ್ಫ್. in 15 to 20 minutes. This is called Urolift. I am working in Ramaiah, so it is there. All these things are there. We are doing all of these procedures. Urolift antibi, where nothing is removed. We just put an implant to keep the prostate open, to open the channel. This takes around 15 minutes and as a daycare. And patient need not miss work or take rest. He can get back to normal activities in 1 or 2 days. So this is one brief video about the TURP, the ಹೇಗ್ ಮಾಡ್ತೀವಿ. ಈಗ this is an endoscopic vision. ಇದು ಒಳಗಡೆ prostate ಒಳಗಡೆ ಹೋಗಿದೀವಿ. And now you can see the bladder. This is the opening of the ureteric orifice antivi. So this is the prostate gland, which is, you can see, protruding inside and causing obstruction. So this is with the electric current. This is called TURP. We cut the enlarged part. So I won't play the entire video. So you can see here how we are cutting the prostate, and all these parts of the prostate are removed from the urethra itself. So we make a wide cavity. Cavity madadmale a patient will be able to pass urine freely. Okay. So there can be certain side effects of surgery. Because we have resected that part, patient can have little burning pain for a few days. Salpa uche uri, salpa bleeding agbodu. But generally within 1 week, ellaru will be back to routine activities, and generally antadin major complications in irala. But one issue of either URP or laser is ejaculation agal. That fluid aache barodu ad barala. So some men want that to be preserved. So now this is the latest procedure. This is called Urolift. Idralli we just something like a staplers hakti olgade to keep the prostate open. In this, nothing is removed. Cut madala, there is no cutting, and nothing is removed. It is just a mechanical procedure to keep the prostate open. And so this is a daycare. So you can see that we have put the clips here to keep it open. And the advantage of this is patients can preserve the ejaculation and get back to work much quicker. This is one more latest procedure. I'm happy to tell you that at Ramaiah, we were one of the first in the country to perform this procedure. ITIND ಅಂತ ಹೇಳ್ತೀವಿ. ITIND full form is temporary implantable nitinol device, especially useful in younger men, age group of 40 to 50, who don't want to start medical treatment. So this is an OPD procedure where we put a implant into the prostatic cavity. That advantage enandre it will keep it open, and then after a week the implant is removed. It causes remodeling. So this is especially useful in younger men. You can see this here. This is the implant. Okay, so this is the implant which keeps the prostate open. And then once the remodeling has occurred in 1 week, the implant is removed. So nothing is left inside. So this is called the ITIN procedure. This was there in US for many years. It has come to India recently last year. And we were the first in the country to perform this procedure. So these were some of the treatment options for benign enlargement of prostate. Now, ಸ್ವಲ್ಪ prostate cancer ಬಗ್ಗೆ ಮಾತಾಡೋಣ. So prostate cancer, sometimes symptoms ಏನು ಇರ್ಲಿಕ್ಕಿಲ್ಲ, but sometimes symptoms can mimic the symptoms of benign enlargement of prostate. ಈಗ as I told you, benign enlargement ನಲ್ಲಿ poor flow, frequent urination. So same thing can be in prostate cancer also. But in very advanced stages, stage 4 ನಲ್ಲಿ prostate cancer can spread to the bones. So patient can come with backache, joint pain, hip pain, because prostate cancer, it spreads very commonly to the bones. That is in the last stage. So idu evaluation hegandre, first, as I mentioned, digital rectal examination. Motion jagadalli beral hakbittu we feel the prostate. Prostate cancer nalli sometimes it is hard. They can be nodules, bumpy ತರ ಇರುತ್ತೆ prostate. PSA ಅಂತ ಟೆಸ್ಟ್ ಮಾಡ್ತೀವಿ. PSA ಜಾಸ್ತಿ ಇದ್ದಾಗ ನಾವು ಬಯಾಪ್ಸಿ ಮಾಡಬೇಕಾಗುತ್ತೆ. So this diagram shows that there are different zones in the prostate gland. Generally, the prostate enlargement ಆಗೋದು ಏಜ್ ರಿಲೇಟೆಡ್, ಅದು ಟ್ರಾನ್ಸಿಷನಲ್ ಝೋನ್ ನಲ್ಲಿ ಆಗುತ್ತೆ. ಕ್ಯಾನ್ಸರ್ ಪೆರಿಫರಲ್ ಝೋನ್ ನಲ್ಲಿ ಆಗುತ್ತೆ. So once PSA is elevated, we do what is called as a biopsy. This is OPD procedure to confirm what we are dealing with. Is it prostate cancer or enlarged prostate or some other thing? The prostate biopsy ant martivi. We take some 12 pieces, 6 to 12 pieces from the prostate, which is painless under local anesthesia, and we send for biopsy. And once biopsy abandmele, we see what the result is and then do the needful based on the stage of the prostate, which is done by MRI or the PET scan. So, as I told you, the common sites where the prostate cancer spreads is the bone and the lymph nodes. So we should not, the take-home message should be that we should not wait for the stage 4. In the initial stages, prostate cancer is very much curable and 100% good results can be obtained. So very important to do the PSA annual checkup. Now coming to the treatment engandre, it depends on the stage of the prostate cancer. Iga stage 1 cancer andre, it is confined only to the prostate gland, bere ellu spread agilla. So such patients can be treated with surgery, which is robotic surgery. Innu salpa advanced agide, prostate ಇಂದ ಸ್ವಲ್ಪ ಆಚೆ ಹೋಗಿದೆ, lymph node spread ಆಗಿದೆ ಅಂತ patients ಗೆ ನಾವು radiation therapy ಕೊಡ್ತೀವಿ along with what we call as hormonal therapy. ಆಮೇಲೆ ಪೂರ್ತಿ ಅಡ್ವಾನ್ಸ್ಡ್ ಸ್ಟೇಜ್ 4 ಅವ್ರಿಗೆ ಏನು ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂದ್ರೆ ಸರ್ಜರಿ ಮಾಡಕ್ ಆಗಲ್ಲ, ಬಟ್ ಅವ್ರಿಗೆ ನಾವು ಹಾರ್ಮೋನಲ್ ಥೆರಪಿ ಅಂತ ಕೊಡ್ತೀವಿ. One important point ಏನಂದ್ರೆ prostate cancer compared to other cancer, it is very slowly growing. So even if stage 4, many men can have good life with the hormonal therapy and sometimes even chemotherapy. So robotic prostatectomy, ado prostate cancer the treatment, and at Ramaiah we have this Da Vinci robot anta. It is a advanced form of treatment. Idralli ಏನಂದ್ರೆ it is sometimes it is similar to laparoscopic surgery, but in laparoscopy the surgeon is holding the instruments. Illi robotic arms will hold the instruments. Surgeon is sitting at a console like cockpit ತರ ಅಲ್ಲಿ ಕೂತ್ಕೊಂಡು we move the hands, the joysticks ತರ ಇರುತ್ತೆ. ನಾವು ಏನ್ ಮೂವ್ಮೆಂಟ್ ಮಾಡ್ತೀವಿ ಅದೇ ಮೂವ್ಮೆಂಟ್ robotic ಒಳಗಡೆ ಮಾಡುತ್ತೆ. So advantage of robotic surgery is enhanced magnification, 10 times magnification compared to normal surgery, 3D vision, and you can do fine movements, and the advantage is we can have good results with minimal collateral damage, and patient blood loss will be less. Patient can get discharged earlier, hospital stay kammi irutte, and complications will be less, and patient can get back to work much quicker. So this is just a small picture showing this is a already ports anta haaktivi, the robotic arms. And just a brief video to show how the robotic instruments move. So this is how the robotic instruments move. Whatever movements the surgeon does at the console, ade prakara instruments already move agutte, and we can have good surgical outcomes. So to conclude, do not neglect any urinary symptoms. In frequency, urgency ಇದೆ, ಪದೇ ಪದೇ ನೈಟ್ ಎದ್ದೇಳ್ಬೇಕಾಗ್ತಾ ಇದೆ, ಸ್ಟ್ರೀಮ್ ಕ್ಲಿಯರ್ ಆಗಿ ಬರ್ತಾ ಇಲ್ಲ. So if any of these symptoms are there, immediately consult a urologist. And BPH can be treated medically with medicines or by TURP, laser, and what I told you as the latest is the MIST. MIST stands for minimally invasive surgical treatment. Thirdly, all men above the age of 50 years kindly get a serum PSA test, simple blood test. And if prostate cancer is picked up early, the results can be excellent. Thank you. Can have some questions?
Yes, sir. Yes. Yes, sir. Thank you, sir. Thank you for very short and crisp presentation covering the entire aspects of prostate. So basically, prostatal, there are only three things like BPH, prostatitis, and prostate cancer. And to large extent, ಎಲ್ಲ ಒಂಥರ ಸ್ಟ್ರೀಮ್ಲೈನ್ಡ್ ಅಂದರೆ ಯಾವುದಿದ್ದಾಗ ಏನು ಮಾಡಬೇಕು ಅನ್ನೋದು ಇಟ್ ಇಸ್ ವೆರಿ ಲಿಟಲ್ ಕಾಂಟ್ರವರ್ಸಿ ಆಸ್ ಫಾರ್ ಆಸ್ ಐ ಇವನ್ ಐ ಆಮ್ ನಾಟ್ ಹೊಸ ಟೆಕ್ನಿಕ್ಸ್ ಎಲ್ಲ ಗೊತ್ತಿಲ್ಲದಲ್ಲೇ ಇರ್ಬೋದು, ಬಟ್ ಅದರ್ವೈಸ್ ಇಟ್ ಇಸ್ ಆಲ್ ವೆರಿ ಕ್ಲಿಯರ್ ಕಟ್ ಯಾವ ಸ್ಟೇಜಿಗೆ ಏನು ಮಾಡಬೇಕು ಅಂತ. ಸೊ ಅದನ್ನು ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ದಾರೆ. ಐ ಥಿಂಕ್ ಒಬ್ಬರು ನಮ್ಮಲ್ಲಿ ಯಾರೋ ಭಾಳ ಡೀಟೇಲ್ಡಾಗಿ ಬರೆದಿದ್ದಾರೆ. ಐ ಥಿಂಕ್ ಲೆಟ್ ಮಿ ರೀಡ್ ಇನ್ ಟು ದಿಸ್ ಕ್ವೆಶನ್. ದರ್ ಇಸ್ ಒನ್ ಪರ್ಸನ್ ಮೈ ನೇಮ್ ಮಿಸ್ಟರ್ ಕಾರ್ತಿಕ್ ಹೂ ಇಸ್ ಇನ್ ಅವರ್ ದಿಸ್ ಥಿಂಗ್. ಸೊ ಅವರಿಗೇನೋ ಇದೆ ಇದು ಆಸ್ ಫಾರ್ ಆಸ್ ಐ ರಿಮೆಂಬರ್. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ದ ಪ್ರೆಸೆಂಟೇಷನ್ ಡಾಕ್ಟರ್ ತರುಣ್. ಸಾರಿ ಫಾರ್ ಟೂ ಮೆನಿ ಕ್ವೆಶನ್ಸ್. ವಾಟ್ ಲೈಫ್ ಸ್ಟೈಲ್, ಸೊ ಒಂದೊಂದೇ ತೊಗೊಳ್ಳೋಣ. ವಾಟ್ ಲೈಫ್ ಸ್ಟೈಲ್ changes slow down the growth of prostate? ಈಗ ಆಫ್ಟರ್ ಸರ್ಟನ್ ಏಜ್ ಡೆಫಿನೆಟ್ಲಿ prostate hypertrophy ಆಗುತ್ತೆ. It's mainly because of the hormonal ಇದು. So is there something that we can do to slow down?
See, there is no lifestyle changes which can slow down the growth of prostate, but there are lifestyle changes which can decrease the symptoms because of enlarged prostate. Now, growth of prostate is genetically determined and depends on the hormonal changes. But prostate causing symptoms like frequent urination, all that, or urinary infections can be controlled with lifestyle modification, like moderating the amount of fluid intake, decreasing the bladder irritants like tea, coffee, and controlling blood sugars, especially in diabetics. So these things can be done.
And are the symptoms more, if say for example somebody is not diabetic, with respect to somebody is diabetic, ಅವರಿಗೆ ಜಾಸ್ತಿ ಬೇಗ ಸಿಂಪ್ಟಮ್ಸ್ ಬರುತ್ತಾ?
No, it's not dependent on that.
Independent.
The diabetics or non-diabetics both can get symptoms. ಏನಾಗುತ್ತಂದ್ರೆ diabetics, they are prone for urinary tract infection. A diabetic patient with the enlarged prostate, because of the holdup of urine, with the added insult of uncontrolled sugars, they are more likely to develop urinary tract infection compared to the normal person with just enlarged prostate. So that's why it's important to control the sugars. Secondly, if high blood sugar levels, they'll have polyuria. They'll have polydipsia, polyuria, increased urination, increased quantity of urine output. And that along with the prostate will super add, and that can cause more problems.
Yes.
So diabetes has to be controlled.
Okay. So the next question is, how effective are foods like tomato, pumpkin seeds, and herbs, like say palmetto, or traditional drugs? Because there are some foods that say it's good for prostate health. So I just wanted to know what is your take on that.
Now, herbs like saw palmetto have been used in US and all those US and Western European countries. It's an alternative to the traditional allopathic, but we don't have much this thing about the saw palmetto. Now, regarding the foods, hardly any real benefit. They don't make much changes. If symptoms are there, best is to go for the medical treatment, tried and tested allopathic drugs.
And if somebody starts on a medication, so without medication and with medication, does it change the timeline of surgery? ಅಂದರೆ ಮೆಡಿಸಿನ್ಸ್ ತಗೊಳ್ಳೋದ್ರಿಂದ ಸರ್ಜರಿನ ಜಾಸ್ತಿ ದಿನ ಪೋಸ್ಟ್ಪೋನ್ ಮಾಡ್ಬೋದಾ, ಯಾವ ರೀತಿ?
So nowadays the concept has changed to earlier intervention.
Okay.
Previously we used to give medications thinking it will postpone, but ಏನಾಗುತ್ತಂದ್ರೆ now the concept is the bladder undergoes certain irreversible changes. Before that sets in, if we treat earlier, patients can have better relief of symptoms. But having said that, we give the choice to the patient. Some men are comfortable with medications, especially those with mild to moderate symptoms. We can keep them on medications for long term. It is not like an antibiotic course. You take it for 7 days and then stop. Prostate medications have to be taken long term, just like sugar and BP medicines, probably for years. But having said that, there are certain absolute indications for surgery. What are the absolute indications? Recurrent urinary infection, recurrent retention of urine, bleeding, formation of bladder stones, or swelling of the kidneys because of the prostate obstruction, or side effects of the medicine. These are all the absolute indications for surgery.
ಓಕೆ ಫೈನ್ ಸರ್. ಆ್ಯಂಡ್ ಏಜ್ ವೈಸ್ ನೀವು ನೋಡೋದಾದರೆ ಮೊದಲು ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ಪ್ರಾಬ್ಲಿ ಸೇ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ 20 years ವೆನ್ ಯು ಆರ್ ಡೂಯಿಂಗ್ ಟ್ರೈನಿಂಗ್, ಈಗ ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ಆರ್ ಯಂಗರ್ ಪೀಪಲ್ ಗೆಟಿಂಗ್ ಮೋರ್ ಪ್ರಾಸ್ಟೇಟ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ನೌ? ಆರ್ ಯು ಸೀಯಿಂಗ್ ದಿಸ್ ಆರ್ ಇಸ್ ಇಟ್ ದ ಸೇಮ್?
I think they are more aware now.
Okay.
So that's why they are coming forward and getting treated. That is one thing. Secondly, nowadays many men are getting the PSA tested as part of their annual health checkup or executive checkup. Previously, during our training days, we used to get a lot of advanced prostate cancers and stage 4 already spread ಆಗಿರುತ್ತೆ. But now, because of screening and PSA, we are picking up prostate cancer at an early stage. So where complete cure is possible. So in that sense, we are seeing more cases of prostate cancer because of earlier screening.
And if, say, for example, somebody is detected very early, so they say there is no best cancer to have. If at all you want to choose one, probably choose a prostate cancer. So what is the outlook?
It is true to some extent, but not in all cases. Prostate cancer behaves differently in different men. Generally, it is a slow growing cancer, but there can be some aggressive variants like ductal carcinoma of prostate antivi, neuroendocrine variant of prostate cancer. So there are certain aggressive variants, but generally it is slow growing.
And if it is detected early, the long-term survival rates generally are very good.
Long-term is very good.
And ಇನ್ನೊಂದು ಕ್ವೆಶನ್ ಕೇಳ್ತಾರೆ ಸರ್, ಮೆನಿ ಸಿಂಪ್ಟಮ್ಸ್ ಲೈಕ್ BPH ಮತ್ತು prostatitis, prostate cancer symptoms ಎಲ್ಲ ಓವರ್ಲ್ಯಾಪ್ ಆಗುತ್ತೆ. ಹೌ ಡು ಯು ಡಿಫ್ರೆನ್ಶಿಯೇಟ್ ಅಂತ?
Yes, so many of a very good question. Symptoms can overlap. Sometimes in prostate cancer, there can be no symptoms also. Patient has just gone for a routine checkup. He has found a PSA high. Then we do a biopsy, we pick up prostate cancer. That is becoming more and more frequent nowadays. Prostatitis nalli more of painful urination, pelvic pain, painful pain during ejaculation. These are all the symptoms of prostatitis. For them, we suggest prostate massage and medications. BPH symptoms are typical, but the symptoms can overlap. So the best way is to do further testing in the form of PSA, and rectal examination is very important.
So what is the earliest age by which normally you recommend doing a PSA? Is it 50 ಅಥವಾ ಇನ್ನು ಮುಂಚೆನೇ ಮಾಡಬೇಕಾ if there is a family history?
Yeah, so as per the American Urology Association guidelines, all men above 50-55 need to get a PSA testing done. If there is a family history of prostate cancer, like say father, brother, or the women in their family have a BRCA gene,
Yes.
like for ovarian cancer, breast cancer, if that is there, they have to start screening at an earlier age, at the age of 45, if there's a strong family history. Otherwise, 50 to 55 years, we can do a PSA test. If PSA is less than 1, then you can do it every 2 years. If PSA is more than 1, then you can do it more frequently. If it goes above 3.54, then what we do is we triage the patient by doing a MRI, which gives a scoring system 1, 2, 3, 4, 5. If the MRI score is 3, 4, 5, then these are the patients we take up for biopsy. If it is 1 and 2, we just wait and watch.
Yes. And what is the role for getting this free PSA, total free ratio? Does it add any other information to just getting PSA?
In equivocal cases, ಸ್ವಲ್ಪ doubt idaga we can do free PSA, but majority of the time we're getting only the total PSA done.
Okay. ಅಂದ್ರೆ ಟೋಟಲ್ PSA ಕಮ್ಮಿ ಇದ್ರೆ ದೆನ್ ಪ್ರಾಬಬ್ಲಿ ಅದನ್ನ ಮಾಡೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ ಅನ್ಸುತ್ತೆ. ಬಾರ್ಡರ್ ಲೈನ್ ಅಲ್ಲಿ ದೆನ್ ಪ್ರಾಬಬ್ಲಿ ದಿಸ್ ಇಸ್
ಬಾರ್ಡರ್ ಲೈನ್. Yeah.
Okay, fine, sir. And the next question is, testosterone is an important hormone to men, but prostate medicine reduces testosterone. How to balance both?
Yeah, it's a good question. So these are some of the side effects of the prostate medications. They can reduce the what we call as the active forms of testosterone, and that can cause decrease in the libido and sexual performance. So men who don't want to take such medicines, who are more sexually active, then we suggest as I mentioned, the Urolift or iTindo, all these procedures are there, where men can maintain their sexual potency as well as the ejaculation. Not all prostate medications cause decrease in testosterone. The routinely used alpha blockers, which we tell tamsulosin, sulodocin, they don't decrease the testosterone, but they prevent the ejaculation. The other type of drugs, I didn't go into it, they are called 5-alpha red inhibitors, like dutasteride, finasteride, that is prescribed along with the alpha blockers as a combination for men with prostate sizes more than 40-50 cc's. This component of the combination, the finasteride, dutasteride, they cause loss of libido. But not all prostate medicines.
So if somebody doesn't want these symptoms, they want to maintain a sexually active life. Now, at least we have this option of minor early interventions, surgical interventions, where they don't have to depend on medications.
Yes, yes.
And the early intervention ಹೇಳಿದ್ರಲ್ಲ ಸರ್, ಸೊ ದಿಸ್ ಯೂರೋಲಿಫ್ಟ್ ಅಂಡ್ ಅದರ್ ಪ್ರೊಸೀಜರ್ಸ್, ಅದು ಇಸ್ ಇಟ್ ಒನ್ ಟೈಮ್ ಟ್ರೀಟ್ಮೆಂಟ್, ವಿಲ್ ಇಟ್ ಪೋಸ್ಟ್ಪೋನ್, ಯಾವ ರೀತಿ ಇರುತ್ತೆ ಅಂದರೆ ಇಸ್ ಇಟ್ ಜಸ್ಟ್ ಟೈಮ್ ಬೈಯಿಂಗ್ ಆಪ್ಷನ್ ಆರ್ ಹೌಸ್ ಇಟ್?
So Urolift and iTind, all these minimally invasive therapies are not for all types of patients. There is certain prostate size, say between 30 to 80 grams, where this is useful. And there is, after 10 years, there is a risk of there is a chance of reintervention of around 10 to 20%. That means out of every 100 patients, after 10 years, some of these patients may require an additional implant or any other additional treatment. Whereas the TURP or the laser generally is a one-time solution.
But even 10 years is a good timeline.
Yeah, 10 years is good.
For 90% of people.
Yes.
I think, yes. So there is a lot of information. ಯಾಕಂದ್ರೆ ಇಷ್ಟೊಂದು ನ್ಯೂವರ್ ಲೈಕ್ ಈವನ್ ಫಾರ್ ಡಾಕ್ಟರ್ಸ್ ನಮಗೂ ಗೊತ್ತಿರಲ್ಲ, ಅಂದರೆ ಎಲ್ಲ ಫೀಲ್ಡಲ್ಲೂ ಹೊಸದಾಗಿ ಏನು ಬರ್ತಾ ಇದೆ ಅಂತ. ಐ ಥಿಂಕ್ ಇಟ್ ಇಸ್ ಅ ಗುಡ್ ಥಿಂಗ್ ದಟ್ ಇವನ್ ಬೇರೆಯವ್ರಿಗೂ ಎಲ್ಲ ಗೊತ್ತಾಗ್ತದೆ ಅಂತ. ಸೊ ದಟ್ಸ್ ಅ ಗುಡ್ ಥಿಂಗ್ ಸರ್. ಆ್ಯಂಡ್ ಕಪಲ್ ಆಫ್ ಮೋರ್ ಕ್ವೆಶನ್ಸ್. ಸೊ ಟೆಸ್ಟೋಸ್ಟಿರಾನ್ ಬಗ್ಗೆ ಹೇಳಿದ್ರು, ಆ್ಯಂಡ್ how much water consumption is optimal after 50 to prevent nocturia, at the same time have good hydration and kidney health?
So for this, there is no fixed figure actually. What we tell patients is drink adequate water so that your urine color is light yellow or white.
Yes.
That is the only thing, because it depends again on the seasonal variation, depends on the activity of the person. Some are more active, will require, of course, more fluid intake. Some leading more sedentary life may not require that much. So best way to gauge is check the color of your urine. It should be pale yellow or white. So if it is darker yellow, drink more water. That's all.
Yes. And one more this thing is, say you can do what is called as a front loading of water intake. ಅಂದರೆ ನಿಮ್ಮ ವಾಟರ್ ಇಂಟೇಕ್ನ ಆದಷ್ಟು ಮಾರ್ನಿಂಗ್ ಟೈಮ್ಸಲ್ಲಿ ಮುಗಿಸ್ಕೊಂಡ್ರೆ ಬಿಫೋರ್ ಈವ್ನಿಂಗ್, ಆ್ಯಂಡ್ ಲೇಟ್ ಈವ್ನಿಂಗ್ ವಾಟರ್ ಇಂಟೇಕ್ನ ಕಮ್ಮಿ ಮಾಡೋದು. ಆ್ಯಂಡ್ ಆಸ್ ಟೋಲ್ಡ್,
so what we tell, especially for patients with nocturia, is have early dinner, and during dinner have some water. After that, give a 2 hours break. During that time, you go for a walk or do something else, and then pass urine, and then go to bed. In this 2 hours, don't take any fluids and avoid alcohol or tea, coffee. With this, they can decrease the nocturia symptoms to a large extent.
Yes, sir. So actually early dinner is one of the first concept in our program. That's our basic program. The first thing that we ask people to do is early dinner. Yes. So I think that will help. And stimulants, as sir told, ಬಹಳ ಜನಕ್ಕೆ ಈವ್ನಿಂಗ್ ಅವು ಡ್ರಿಂಕ್ಸ್ ಅಂದರೆ ಆಲ್ಕೋಹಾಲ್ ಆಗಿರ್ಬೋದು, ಕಾಫಿ, ಟೀ ಅದೆಲ್ಲ ತಗೊಳ್ಳೋದ್ರಿಂದ ಅದರಿಂದನೂ ನಿಮ್ಮ ಅಂದರೆ ನೈಟ್ ಏಳೋದು ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ನಿಮ್ಮ
Yes.
ಅದರಿಂದ ನಿದ್ದೆನೂ ಡಿಸ್ಟರ್ಬ್ ಆಗುತ್ತೆ, ಒಂದ್ಸಲ ಎದ್ಮೇಲೆ ಮತ್ತೆ ನಿದ್ದೆ ಬರಲ್ಲ. ಸೊ ಆಲ್ ದಿಸ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ವಿಲ್ ಹ್ಯಾಪನ್. ಸೊ ಇದನ್ನು ಮಾಡ್ಬೋದು. ಆ್ಯಂಡ್ ನೋಟಿಸಿಂಗ್ ದ ಕಲರ್ ಆಫ್ ದ ಯೂರಿನ್, ಲೈಕ್ ದಟ್ ಈಸ್ ವಾಟ್ ವಿ ಆಲ್ಸೋ ಸೇ ಇನ್ ದ ಪ್ರೋಗ್ರಾಮ್. ಯೂರಿನ್ ಕಲರ್ನ ನೀವು ನೋಡಿಕೊಂಡ್ರೆ ದೆನ್ ದಟ್ಸ್ ಅ ಬೆಸ್ಟ್ ಗೈಡ್ ಇನ್ ಟರ್ಮ್ಸ್, ರಾದರ್ ದೆನ್ ಥಿಂಕಿಂಗ್ ಎಷ್ಟು ವಾಲ್ಯೂಮ್ ಬೇಕು ಅಂತ. ಬಟ್ ಆಸ್ ನೀವು ಅದನ್ನು ನೋಡ್ತಾರೆ ಅವ್ರಿಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ದಿಸ್ ಇಸ್ ದ ಅಮೌಂಟ್ ಆಫ್ ವಾಟರ್ ಇಂಟೇಕ್ ದಟ್ ಪ್ರಾಬ್ಲಿ ದೇ ನೀಡ್. ಆ್ಯಂಡ್ ಒನ್ ಮೋರ್ ಥಿಂಗ್ ವಾಟ್ ಐ ವಾಂಟೆಡ್ ಟು ಮೆನ್ಷನ್ ಅಂದರೆ, ಇನ್ಸ್ಟೆಡ್ ಆಫ್ ಡೈರೆಕ್ಟ್ಲಿ ಡ್ರಿಂಕಿಂಗ್ ಆರ್ ಗಲ್ಪಿಂಗ್ ವಾಟರ್, ಪ್ರಾಬಬ್ಲಿ ಸ್ವಲ್ಪ ವೆರಿ ಫ್ರೀಕ್ವೆಂಟ್ಲಿ ತಗೊಳ್ಳೋದು ಆಲ್ಸೋ ಇಟ್ ವಿಲ್ ಹೆಲ್ಪ್ ಅಂತ ಐ ಥಿಂಕ್ ಐ ಹ್ಯಾವ್ ರೆಡ್ ಸಮ್ವೇರ್. ಐ ಡೋಂಟ್ ನೋ, ಐ ವಾಂಟ್ ಟು ಹ್ಯಾವ್ ಯುವರ್.
Yeah, of course. Patient should not take more at once. Small, frequent, and by fluids we mean not only water, but also things like majige, so tea, coffee, all those also we have to factor into the account.
Water, yes, yes,
Yeah.
yes, sir. Yes, sir. Okay, I think ಸುಮಾರು ಅವ್ರು ಕೇಳಿದ ಕ್ವೆಶನ್ಸ್ ಎಲ್ಲ ಮುಗಿದಿದೆ. ಬೇರೆ ಯಾರಿಗಾದ್ರೂ ಏನಾದರೂ ಕ್ವೆಶನ್ಸ್ ಇದೆ? ಇಫ್ ಯು ದೇರ್ ಆರ್ ಎನಿ ಕ್ವೆಶನ್ಸ್ ದಟ್ ಯು ವಾಂಟ್ ಟು ಆಸ್ಕ್, ನೀವು ಕೇಳ್ಬೋದು. ಅಂಡ್ ಇಫ್ ಐ ಥಿಂಕ್ ಐ ಡೋಂಟ್ ನೋ ಹೌ ಇಸ್ ಯುವರ್ ಟೈಮ್, ಸರ್. ಇಫ್ ಯುವರ್ ಟೈಮ್ ಇಸ್ you are short of time, then we can show you.
No, if any questions are there, I'll be happy to answer.
Okay, yes. And before people ask any questions, I just wanted to tell, ಈಗ ನೀವು ಯಾವತ್ತು ಸಿಗ್ತೀರಾ, if somebody wants to consult you for this thing, what are your days? And Ramaiah is...
Yeah, I'm at Ramaiah Memorial Hospital, ground floor, room number 3. I'm here every day. But Monday, Wednesday, Friday is preferable. 9 to 4, anytime you can just walk in.
Yes.
And you can just ask for me. I'm here almost all days, actually.
Okay, so just ಯಾರಿಗಾದ್ರೂ any urology related problems. So because as sir said, there are a lot of facilities, newer facilities. ಹೊಸದಾಗೆ ಅವರು ಹೇಳ್ದಂಗೆ ಫಸ್ಟ್ ಟೈಮ್ ಇನ್ ಇಂಡಿಯಾ ಒಂದು ಆಪರೇಷನ್ ಮಾಡಿದ್ದಾರೆ. ಆ್ಯಂಡ್ ಈವನ್ ಡಾ ವಿಂಚಿ ರೋಬೋಟ್, the most advanced robotic system in the world. I think everything is there. So I think you will be in the best hands if at all you require.
One more thing is, of course, one is the armamentarium, which I told you. We have different lasers, the holmium laser, the thulium fiber laser, and newer therapies. But one more thing which we have started is a thing called the bladder rehab clinic. This is specially useful for women and also men and children also, who are having urinary problems, which do not qualify for surgical treatment, especially women who are having frequency, urgency, stress incontinence and healthy. When they cough or sneeze, urine comes out because of the weak pelvic floor muscles. So for them, there is a pelvic floor biofeedback therapy and now start ಮಾಡಿದೀವಿ. So with that, at least 60 to 70% can avoid surgeries. With the it's an advanced form of Kegel exercises, which is called biofeedback. It's one of a kind. It's called our bladder rehab clinic, and it is useful for many women and some children also.
Children andre ಯಾರಿಗೆ especially
ಯಾರಿಗೆ voiding dysfunction ಅಂತ ಹೇಳ್ತೀವಿ, which is very common in children. Like normally when a person passes urine, the bladder, when it contracts, the sphincter should relax, external sphincter. Some children, because of behavioral issues or school nally, sometimes the teacher does not allow them to go for toilet. Over time, long term, it becomes a habitual, or they're playing video games or some games, they become so concentrated, engrossed, they tend to hold urine. And when they pass urine, the sphincter is closed. Okay, dysfunctional voiding antive. So urine comes as a stop and go tara, up and down downstream. So for them also, this biofeedback therapy is very useful. They help to retrains the muscles, and also patients with constipation. So there are some of the an overactive bladder. Bladder is overactive, repeated frequency, urgency, unrelated to the prostate or any other condition. It's idiopathic overactive bladder. For all these people, this biofeedback therapy is very useful.
And one more question, sir. If children having this voiding during bed voiding, what do you call it? Bedwetting. Yes. So can you just throw some light on this? Because not many people discuss this. Yeah.
So sometimes, see, bedwetting generally up to the age of 7, 8 years, we don't really do. look into it. If it persists even after that, then one thing, initially we start with behavioral therapy. First, we tell the parents not to scold the child or make the child feel embarrassed. Because it then sets up a vicious cycle. The cycle will never stop. To be very considerate, and behavior changes like making alarm therapy and healthy way, waking up the child in the night to pass urine. So all these things can be done. If with that also it is not improving, then we start them on some medications to decrease the nighttime urination. It's very safe medicines, but generally children grow out of it.
Yes.
And by age of around 12, 13, generally majority grow out of it. If it's still persisting, then we have to do some further investigations. Along with bedwetting, very important to see whether in the daytime also they are having any urinary problems. If only night bedwetting, rest of the day they are fine, flow is good, no frequency, nothing to worry. They'll grow out of it, do some behavior modifications. If in the morning time also they're having problem, frequency, urgency, they leak aagta ಇದೆ urine, no, then it has to be looked into. It could be some form of a neurogenic bladder antivi, or non-neurogenic bladder. So that has to be looked into more carefully.
Yes. And there is one more question in the Q&A where somebody has asked, can you suggest any yoga anta keltare to improve premature ejaculation and erectile dysfunction? I don't know specifically yoga. So what else can be done for if somebody has premature ejaculation or erectile dysfunction?
Yeah. So
I think there is a clinic in your this thing for andrology as well, right?
Yeah, I take care of andrology also.
Okay. Yeah.
So specific yoga therapy, I'm not sure.
Yes.
But for the premature ejaculation, as I told you, biofeedback therapy is very good. It trains the bulbocavernous muscle and the ischiocavernosus muscle, which control the ejaculation. It's type of a Kegels, advanced form of Kegels, which strengthens those muscles. So patient is able to hold back the ejaculation. So that is the biofeedback therapy. We start off with these things. Secondly, any anxiety, stress, psychological aspects come into role in the treatment of erection dysfunction and premature ejaculation. So any psychiatric or psychological issues need to be addressed. Behavioral therapy, lifestyle modification, biofeedback, ಇದೆಲ್ಲ ಆಗಿಲ್ಲ ಅಂದ್ರೆ there are medicines to help the patients. There are medicines to improve the erections. There are medicines to delay the ejaculation also.
Yes. And definitely in terms of erectile dysfunction, so lifestyle modifications definitely play a huge role in this, right? Because metabolic syndrome, diabetes, obesity, they say erectile dysfunction is premature to cardiac
of course,
related problems.
The penile artery, the cavernous is much smaller than the coronary arteries. So if there are any metabolic issues, hypertriglyceridemia, cholesterol, diabetes, all that leads to plaque formation first in the penile arteries.
Yes.
So if there is erectile dysfunction in a 40-year-old, that means the next 5 to 10 years he can have a coronary event or a cardiovascular event or a stroke. So it's one of the first markers of metabolic issues. So these patients need to be comprehensively checked. Check their sugars, BP, cholesterol, whether they are in a sedentary lifestyle, smoking, very important, smoking has to be stopped, reduce alcohol intake. All these lifestyle modification and risk factor reduction helps not only the erection issues, but later decreases the chances of coronary event and cardiovascular issues.
Yes. 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 Fine, sir. Thank you so much. And I think ಎಲ್ಲ questions ನಾವು ತೊಗೊಂಡಿದ್ದೀವಿ. ಲಾಸ್ಟಿಗೆ ಒಂದು ಕೇಳಿದರೆ ಟಿಲ್ ವಾಟ್ ಏಜ್ ದಿಸ್ ಪರ್ಸಿಸ್ಟ್ ಅಂದರೆ ಲೈಕ್ ಸರ್ ಟೋಲ್ಡ್ ಜನರಲಿ ಏಜ್ ಆಗ್ತಾ ಆಗ್ತಾ ಅದು ಪ್ರಾಬ್ಲಮ್ ಸಾಲ್ವ್ ಆಗೋಗುತ್ತೆ ಆ್ಯಂಡ್ ವೆರಿ ಅನ್ಲೈಕ್ಲಿ ದಟ್ ದೇ ವಿಲ್ ಎವರ್ ರಿಕ್ವೈರ್ ಟ್ರೀಟ್ಮೆಂಟ್, ವೆರಿ ಫ್ಯೂ ಪ್ರಾಬಬಲಿ. ಅಂದರೆ ವಿ ಆರ್ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಅಂದರೆ ಬೆಡ್ ಬಿಟ್ಟಿಂಗ್. ಎಸ್. ಸೊ ಮೋಸ್ಟ್ ಲೈಕ್ಲಿ ಒನ್ಸ್ ದೇ ಕ್ರಾಸ್ 12, 13, 14 years, ಐ ಥಿಂಕ್ ಇಟ್ ವಿಲ್ automatically ತಾನೇ ಹೋಗ್ಬಿಡುತ್ತೆ. Yes.
Very rarely it persists.
Yeah.
If it persists, it has to be looked into.
Yes. So there is one more question, sir. I think this is the last one that they have written urine foam. That's probably like foamy urine idre So is it related to
Foamy urine
protein?
could be because of increased protein leakage in the urine,
Hmm.
especially in diabetics.
Hmm.
Diabetic nephropathy ಅಂತೀವಿ,
Hmm.
where there is leakage of proteins that can cause foamy urine, or any sometimes bacterial infection can also cause foamy urine.
So better to get urinary analysis done.
Urine analysis
Yes.
and get your creatinine checked,
Level.
get your sugars checked.
Yes.
Yeah.
And probably urine albumin creatinine ratio if required. Yes.
Yes.
Yes. Fine. So I think ಕೇಳಿರೋ ಎಲ್ಲ ಕ್ವೆಶನ್ಸ್ ಆನ್ಸರ್ ಆಗಿದೆ. So first of all, on behalf of the Live to 100 community, I would like to thank you for taking time from your busy schedule. So ಅದರಲ್ಲಿ you spent almost an hour with us, and ಎಲ್ಲ ಕಾಂಪ್ರಿಹೆನ್ಸಿವ್ ಆಗಿ ಎವ್ರಿಥಿಂಗ್ ಹ್ಯಾಸ್ ಬಿನ್ ಕವರ್ಡ್. ಆ್ಯಂಡ್ ಐ ಥಿಂಕ್ ಇಟ್ ವಾಸ್ ವೆರಿ ಯೂಸ್ಫುಲ್. ಅಟ್ಲೀಸ್ಟ್ ನನಗಂತೂ ಸುಮಾರು ಗೊತ್ತಿಲ್ಲದೆ ಇರೋದಲ್ಲ, ಹೊಸದು ಕೆಲವು ನ್ಯೂವರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ಸ್ ಅಂತೂ ಗೊತ್ತಾಯಿತು. ಆ್ಯಂಡ್ ಡೆಫಿನೆಟ್ಲಿ ನಮ್ಮ ಆಡಿಯನ್ಸ್ಗೂ ಅಷ್ಟೇ ಇದರಲ್ಲಿ ಇನ್ನೂ ಜಾಸ್ತಿ ಇನ್ಫಾರ್ಮೇಷನ್ ಸಿಕ್ಕಿರುತ್ತೆ ಅಂದ್ಕೊಂಡಿರ್ತೀನಿ. ಸೊ ಥ್ಯಾಂಕ್ ಯು ಸರ್, ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ಬೀಯಿಂಗ್ ಪಾರ್ಟ್ ಆಫ್ ಅವರ್ Live to 100 ಇವೆಂಟ್ಸ್. ಆ್ಯಂಡ್ ಸೊ ಯಾರಿಗಾದ್ರೂ ಎನಿ ಕನ್ಸಲ್ಟೇಷನ್ ಆರ್ ನಿಮಗೆ ಗೊತ್ತಿರೋರಿಗೆ ಅಥವಾ ಯಾರಿಗಾದ್ರೂ ಏನೋ ಯೂರೋಲಾಜಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ ಅಂದರೆ ಪ್ಲೀಸ್ ಗೆಟ್ ಇನ್ ಟಚ್ ವಿತ್ Dr. Tarun. Is available at MS Ramaiah Hospital. Like I said, every day ಇರ್ತಾರೆ ಅಂತ. Monday, Wednesday, Friday, preferably 9 to 4. Ramaiah Memorial Hospital is where you need to go. And ಅದನ್ನು ಮಾಡ್ಬೋದು. So thank you, sir. Thanks. So fine. And just ಏನಾದರೂ ಕ್ವೆಶನ್ಸ್ ಇದ್ರೆ ನಾನು ತೊಗೊಂಡು I'll just close the session. So thank you, sir. Fine. I'll talk to you. Okay. So ಯಾರಿಗಾದ್ರೂ ಎಸ್, ಥ್ಯಾಂಕ್ ಯು. ಫೈನ್. ಥ್ಯಾಂಕ್ ಯು. ಎಸ್. ಓಕೆ, ಫಸ್ಟ್ ಆಫ್ ಆಲ್, ಸೊ ಐ ಹೋಪ್ ಎಲ್ಲರಿಗೂ ಸೆಷನ್ ಇಷ್ಟ ಆಯಿತು ಅಂದ್ಕೊಂಡಿರ್ತೀನಿ. ಆ್ಯಂಡ್ ಸುಮಾರು ಈ ಟಾಪಿಕ್ ಬಗ್ಗೆ ಪ್ರೊಸ್ಟೇಟ್ ಹೆಲ್ತ್, ಎಸ್ಪೆಷಲಿ ಪ್ರೊಸ್ಟೇಟ್ ಹೈಪರ್ಟ್ರೋಪಿ ಆಗಿರ್ಬೋದು, ಯೂರಿನರಿ ಅಬ್ಸ್ಟ್ರಕ್ಷನ್ ಆಗಿ ಯೂರಿನ್ ಫ್ಲೋಗೆ ಆಫ್ಟರ್ 40-50 ಇಯರ್ಸ್ ಆಗೋದಾಗಿರ್ಬೋದು, ಪ್ರಾಸ್ಟೇಟ್ ಇನ್ಫೆಕ್ಷನ್ ಆಗಿರ್ಬೋದು, ಪ್ರೊಸ್ಟೇಟೈಟಿಸ್ ಅಥವಾ ಪ್ರೊಸ್ಟೇಟ್ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಒಂದು ಕಾಂಪ್ರಿಹೆನ್ಸಿವ್ ಆ್ಯಂಡ್ ಶಾರ್ಟ್ ಪ್ರೆಸೆಂಟೇಷನ್ ಇವತ್ತಿನ ಸೆಷನಲ್ಲಿ ನಿಮಗೆ ಸಿಕ್ಕಿದೆ. ಆ್ಯಂಡ್ ಡಾಕ್ಟರ್ ತರುಣ್ ಅವರು ಭಾಳ ಡೀಟೇಲಾಗಿ ಹೇಳಿದ್ದಾರೆ. ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಇಟ್ಸ್ ವೆರಿ ಸಿಂಪಲ್. ಯೂರಿನರಿ ಸಿಂಪ್ಟಮ್ಸ್ ಇದ್ದರೆ ಕನ್ಸಲ್ಟ್ ಮಾಡಬೇಕು. ಆ್ಯಂಡ್ ವಾಟ್ ಎವರ್ ಈಸ್ ದಿ ಡಿಫ್ರೆಂಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಪ್ಷನ್ಸ್ ಇದೆ, ಅದನ್ನು ಯು ಕ್ಯಾನ್ ಡಿಸ್ಕಸ್ ವಿತ್ ಯುವರ್ ಯೂರಾಲಜಿಸ್ಟ್. ಯಾವ ಏಜು, ಯಾವ ಸ್ಟೇಜು ಅನ್ನೋದ್ರ ಮೇಲೆ ದೇ ವಿಲ್ ಡಿಸೈಡ್ ದಟ್ ಲೈನ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಅರ್ಲಿ ಸ್ಟೇಜಸಲ್ಲಿ ಡೆಫಿನೆಟ್ಲಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿಫಿಕೇಷನ್, ಕೆಗಲ್ ಎಕ್ಸಸೈಸಸ್ ಅದೆಲ್ಲ ವರ್ಕ್ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ದೆನ್ ಲೇಟರ್ ಇಫ್ ರಿಕ್ವೈರ್ಡ್ ಮೆಡಿಕೇಷನ್ಸ್ ಅಥವಾ ಸರ್ಜರಿ ಹೋಗ್ಬೋದು. ಆ್ಯಂಡ್ ಪ್ರೊಸ್ಟೇಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಡೆಫಿನೆಟ್ಲಿ ಆಫ್ಟರ್ ದ ಏಜ್ ಆಫ್ 50 ಎವ್ರಿ ಇಯರ್ ಪ್ರಾಸ್ಟೇಟ್ ಸ್ಪೆಸಿಫಿಕ್ ಆ್ಯಂಟಿಜನ್ ಅಂತ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಬೇಕು. ಅದರ ಲೆವೆಲ್ಸ್ ಮೇಲೆ, ಬಿಕಾಸ್ ಇಟ್ಸ್ ಅ ವೆರಿ ಅರ್ಲಿ ಇಂಡಿಕೇಟರ್. ಸೊ ಬಹಳ ಕಮ್ಮಿ ಕ್ಯಾನ್ಸರ್ಗಳಿಗೆ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಇದೆ ನೀವು ಡಿಟೆಕ್ಟ್ ಮಾಡೋದಕ್ಕೆ. ಸೊ ಅದರಲ್ಲಿ ಪ್ರಾಸ್ಟೇಟ್ ಈಸ್ ಒನ್ ಆಫ್ ದಿ ಕ್ಯಾನ್ಸರ್ಸ್ ವೇರ್ ಯು ಕ್ಯಾನ್ ಡಿಟೆಕ್ಟ್ ಇಟ್ ವೆರಿ ಅರ್ಲಿ by doing the simple blood test, prostate specific antigen ಅಂತ, and not very expensive. ಅದನ್ನು ಮಾಡೋದ್ರಿಂದ ನೀವು ಯೂಶಲಿ ಈಗ ಆ್ಯನ್ಯುವಲ್ ಹೆಲ್ತ್ ಚೆಕಪ್ ವರ್ಷಕ್ಕೊಂದ್ಸರಿ ಮಾಡಿಸ್ತಾರೆ. ನೀವು 50 ವರ್ಷ ಕ್ರಾಸ್ ಆಗಿದ್ರೆ ವಾಟ್ ಐ ವಿಲ್ ಸಜೆಸ್ಟ್, ಅಥವಾ ವಾಟ್ ಎವ್ರಿ ಒನ್ ಸಜೆಸ್ಟ್ ಇಸ್ ಅದನ್ನು ನಿಮ್ಮ ಪ್ಯಾನಲಲ್ಲಿ ಸೇರಿಸ್ಕೊಳ್ಳೋದು. ಪ್ರಾಸ್ಟೇಟ್ ಸ್ಪೆಸಿಫಿಕ್ ಆ್ಯಂಟಿಜನ್ನ ಪ್ರತಿ ವರ್ಷ ಮಾಡಿಸ್ಕೊಳ್ಳೋದು ಬಹಳ ಇಂಪಾರ್ಟೆಂಟು. ಅದರ ಲೆವೆಲ್ಸ್ ಬೇಸಿಸ್ ಮೇಲೆ ನೀವು ಫರ್ದರ್ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ಸ್ ಬೇಕಾ ಅನ್ನೋದನ್ನು ನೋಡ್ಬೋದು. ಆ್ಯಂಡ್ ಈವನ್ ಇಫ್ ದೆರ್ ಇಸ್ ಪ್ರಾಸ್ಟೇಟ್ ಕ್ಯಾನ್ಸರ್ ಇದ್ರೂ ಕೂಡ ಅರ್ಲಿ ಸ್ಟೇಜಲ್ಲಿ ಡಿಟೆಕ್ಟ್ ಆದರೆ ದಿ ಲಾಂಗ್ ಟರ್ಮ್ ಸರ್ವೈವಲ್ ಇಸ್ ವೆರಿ 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 ಗುಡ್. ಸೊ ಹಾಗಾಗಿ ಇದನ್ನು ಅರ್ಲಿ ಸ್ಟೇಜಲ್ಲಿ, ಹೆಂಗೆ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಅರ್ಲಿ ಸ್ಟೇಜಲ್ಲಿ ಡಿಟೆಕ್ಟ್ ಆದರೆ ಆಲ್ಮೋಸ್ಟ್ ಲೈಕ್ 100% ಥರ ಇದು ಸುಮಾರು. ಆ್ಯಂಡ್ ಕೆಲವು ಎಕ್ಸ್ಟ್ರೀಮ್ಸ್ ಇರುತ್ತೆ, ಕೆಲವು ಅಗ್ರೆಸಿವ್ ವೇರಿಯಂಟ್ಸ್ ಎಲ್ಲ ಇರುತ್ತೆ. ಅದರ್ವೈಸ್ ಮೋಸ್ಟ್ ಪ್ರಾಸ್ಟೇಟ್ ಕ್ಯಾನ್ಸರ್ಸ್ನ ಲಾಂಗ್ ಟರ್ಮಲ್ಲಿ ಈಸಿಲಿ ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೋದು, ಸರ್ಜರಿ ಆ್ಯಂಡ್ ಅದರ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸಿಂದ. ಸೊ ಹೋಪ್ಫುಲಿ ಈ ಸೆಷನ್ ಎಲ್ಲರಿಗೂ ಇಷ್ಟ ಆಗಿತ್ತು ಅಂದ್ಕೊಂಡಿರ್ತೀನಿ.